Of the following best describes the main pathological feature of generalized osteoporosis. That means what is the clinical feature of generalized osteoporosis? Here the options are reduction in volume of normally mineralized osteoid matrix, increase in volume of normally mineralized osteomatrix, reduction in volume of the abnormally mineralized osteoid matrix, increase in volume of abnormally mineralized osteoid matrix, and significant increase in bony trabecula that are excessively mineralized. So here 2 point important. One of them is the volume of the bones. It is normal, reduce or increase. Then mineralization of the osteoid, it is normal, increase or decrease. So we have to keep in mind in 2 points. That means what is the fate of the volume, what is the fate of the mineral in the bone in case of generalized osteoporosis, which is responsible for pathological fracture. So first of all, let's say this is the healthy bone, and right side this is the osteoporotic cell. What changes occur in case of the normal healthy bone? Here we can see the trabecula, and here the surrounding parts. This is on trabecula, these are the trabecula, and the trabecula, they are very thick in case of the normal healthy bone. But in case of the osteoporotic bone, here we can see the trabecula, they are torn, and they are destroyed, and there is a huge gap production in the osteoporotic bones, as there is a different type of heavy gap present in the osteoporotic cell, the osteoporotic bone. So there is a chance of the pathological fracture. So let's see the osteoporotic osteoporotic stage. First of all, in the healthy bone, here we can see the trabecula, they are definitive, but in case of the second and third picture, the trabecula are getting gradually thinning, and in this third picture there you can see this is very thinning, and there is a big hole or gap producing, which cause weakening of the bone. And finally, in case of minimal trauma, the osteoporotic fracture, that means the secondary fracture or pathological fracture develop. So let's see the osteoporosis. Regarding the osteoporosis, first of all, it causes bone atrophy. So what is atrophy? First of all, let's see atrophy, such as, let's see, this is a cell. When this cell undergone a smaller, this is the atrophy. So what is bone atrophy? The size of the bone is reduced. This is called the bone atrophy. That means the reduction size of the bone, known as the bone atrophy. Also there are some other options, such as when the size same, when there is the size is same, but when there is size same but number increase, it is the metaplasia. When the cell size is directly increased, then it is the hypertrophy. When the cell size reduced, then it is the atrophy. So what is the atrophy of the bone? It is the reduce the size of the bone. And what finally occurs? The anatomical bone is reduced. That means the total bone size, such as a bone involving this area. But in case of osteoporosis, this bone size usually reduce like this. So and it may be generalized, that means in the whole body, or it may be localized in a definitive portion, but it is normally mineralized. That this point is very important, that the mineral, that means the calcium phosphate, hydrogen ion, calcium phosphate, hydrogen, and other the mineral component present in the bones, which is very normal. But the trabecula are greatly thin. The trabecula, which is giving the strength of the bone, which is reduces, and for this condition the tensile strength of the bone is reduced. That means the bending capacity of the bones is reduced, and for this condition there is associated very risk of the pathological fracture. So in case of minimal trauma, that means fall from the little height, it will go pathological fracture, and it is visible on the plain X-ray and also in the DEXA scan. So it can be visible in the plain X-ray, but when we want to get it very early in this condition, the DEXA scan is the best option. So what occurs? What the volume occurs? The volume reduce. That means the size reduce. Then what is the mineral condition? Mineral normal. So volume reduce, mineral normal, it is the osteoporosis. So this is very very important, that volume always reduce, then the mineral it will be normal, mineral normal, but volume reduce due to thinning of the trabecula. Other options here such as the increased volume, no, not increased volume, it is the reduction of the volume.